When you go out there and ask one or two persons about HIV, diabetes, hypertension, hepatitis, COVID-19, just name it, they have one or two things to tell you. But if you ask them what is pre-eclampsia or what is eclampsia, you will be shocked that people don't know what it is, or they are not even aware of what it is. Some of them might have not even heard of it. And these two conditions are killers of women in pregnancy, silent killers of women in pregnancy. Hence, I decided this beautiful afternoon to discuss it with a health professional who will tell us more on it. Hello guys, and welcome back to Kali Space. For my returning subscribers, you are welcome, and for my new subscribers, thank you so much for subscribing to my channel. Know that you are in the right space. Thank you so much. So what is preeclampsia and eclampsia? We need to know what they are.
Okay, thank you very much. I'm going to go straight to the point. I know all of you have heard about hypertension before. Now, preeclampsia is a condition that is seen in pregnancy. A pregnant woman with an elevated blood pressure, with protein in her urine, with or without edema. That is preeclampsia. Do you understand? A woman who is pregnant with an elevated blood pressure or high blood pressure or hypertension plus protein in her urine, a significant protein in her urine, with or without edema. After 20 weeks of gestation, in a previously normotensive woman, a woman who has had normal blood pressure before she got pregnant, that is the word, previously normotensive woman, that is preeclampsia. And eclampsia is preeclampsia with convulsion in pregnancy. You understand? Eclampsia is preeclampsia with convulsion in pregnancy. I just want to make it simple so you understand.
With the definitions or explanation to what eclampsia is and preeclampsia is, I don't need to tell you that it's a serious condition, a serious medical condition in pregnancy that is very, very dangerous. Especially the eclampsia when it comes with convulsion. We know what happens when we see a child who is convulsing. Not to talk of convulsion in a woman that is pregnant. I guess you know what it means. It is a very, very serious medical condition. So thank you so much. These two conditions, preeclampsia or eclampsia, common in pregnancy?
Okay, they are very, very common. In fact, hypertensive disorders in pregnancy is the commonest medical condition in pregnancy. It is more common than diabetes in pregnancy. It is the commonest medical condition in pregnancy, and they are very severe. There are other medical hypertensive disorders. You could have chronic hypertension in pregnancy. This simply means that this woman was hypertensive before she got pregnant. And there is another we call gestational hypertension. It means that this woman was not hypertensive before she got pregnant. The pregnancy started after 28 weeks. I mean, the hypertension started after 28 weeks of pregnancy, but there is no proteinuria, which means there is no protein in this woman's urine. It is when there is protein in her urine plus elevated blood pressure that was diagnosed after 20 weeks of gestation. That is when we make diagnosis, plus or minus edema. That is when you make diagnosis of pre-eclampsia. And eclampsia, which is the number 4 of the hypertensive disorder in pregnancy, is when there is pre-eclampsia and there is grand mal seizure. Seizure simply means convulsion. They are very, very severe in pregnancy.
Having mentioned that these two conditions are severe, who is affected the most, the mother or the baby? Because you've already mentioned that it's a severe medical condition in pregnancy.
Yeah.
No, now who is affected? Is it the mother or the baby?
Okay. The truth is, the morbidity and mortality rates of pre-eclampsia and eclampsia is very, very high. In fact, hypertensive disorder in pregnancy is one of the commonest killer of pregnant women in Nigeria. It accounts for about 14% of maternal mortality in Nigeria after postpartum hemorrhage. Now, who is actually affected the most, you cannot actually tell. But one thing is that it affects both the baby and the mother. No one is spared. No one is spared. Early diagnosis is the best means to contain it.
Okay. Thank you so much. I want to ask, this preeclampsia now, let me just state that. Are there different types of it, or is just a single medical condition?
Okay, there are 2 classes of preeclampsia. The mild preeclampsia and the severe preeclampsia. I know that you will be expecting that there should be moderate.
Of course.
There is no moderate preeclampsia. You either have the mild or the severe preeclampsia. Now, how do you make diagnosis of mild preeclampsia? Now, mild preeclampsia is asymptomatic. The word asymptomatic is that it doesn't show any symptom. And that is why we call hypertension the silent killer. In pregnancy, outside pregnancy, is a silent killer because it does not show any symptom until the end stage of it. Now, mild preeclampsia does not show any symptom. Now you take this woman's blood pressure and you discover that her blood pressure is alleviated. The blood pressure of 140 or of greater than 140 over 90 to less than 160 over 110 millimeter mercury is known as mild preeclampsia. And when you check the urine in dipstick, you discover that it's just 1 plus. It's not more than 1 plus. That is diagnostic of mild preeclampsia. When you check 24 hours urine collection or 24-hour urine estimation, you discover that you have 300 milligram or less than 5 gram in 24 hours is mild preeclampsia. We also make diagnosis of severe preeclampsia when the blood pressure is greater than 160 over 110. Don't forget the first one is less than 160, greater than 140 to less than 160. But now this is greater than 160 over 110 millimeter mercury. That diagnosis would be severe preeclampsia. And you this dipstick urinalysis, you discover that there is 2 plus or more in dipstick, that is diagnostic of severe pre-eclampsia. Now, when you do 24 hours urine collection, you discover that you have more than 5 grams in 24 hours urine collection. That is diagnostic of severe pre-eclampsia. Other things that you have to look out for. These are investigations that will be done. This investigation, you cannot do them at home. You cannot know all these at home. You must see a specialist. Thank you.
Thank you too. Thank you for letting us know that there are different types of preeclampsia. Now, it means that if a woman presents at the hospital on time and they discover that she's having elevated blood pressure and 1 plus protein in the urine, at this stage is safer to
Yes.
manage,
Yes.
very, very safe,
Yes.
rather than when it becomes severe. Because when it becomes severe, most times the woman, you don't have option, you give birth via cesarean section if they cannot handle it much.
Well,
I don't know.
pre-eclampsia in itself is not an indication for
Cesarean
even
section.
severe pre-eclampsia is not an indication for cesarean section, except when there is an unfavorable service along with it. That is when it becomes an indication. But one thing is, at this stage, the woman is at risk. The baby is at risk. The baby can just stop breathing right there in the womb. The heart can stop at once. Right there in the womb. The woman is at risk. The baby is at risk because pre-eclampsia is a multi-systemic disorder. It affects every organs in the body.
To add something like this thing he just mentioned, I have someone who experienced this of recent. She went to the hospital and they detected that her blood pressure was high. I don't know what transpired, why they allowed her to go home. I don't know if actually, but I know when I asked what happened, he said, fine. I went, they said my blood pressure was high. I was asked to go home. And by the time she was returning back to the hospital, guys, I am not saying a pregnancy of 7 months, a pregnancy that is due for delivery. By the time this person was going back to the hospital the following week for checkup, the baby was already dead. Imagine carrying a pregnancy for 9 good months, not 9 seconds. And just interval of 1 week, the story has changed because of this issue.
You see, this is where the doctor would have come in. Now, you just said this pregnancy was already up to 37 completed weeks. Why allow the woman to go when you know that her blood pressure is high? There is protein in her urine. Why allow her to go home? You know this even when she is not actually undergoing labor yet. Induce the labor instantly. The baby would have been spared. You induce the labor instantly. You don't wait. For pre-eclampsia is the mortality, the morbidity and mortality rate is very
Yeah, you
high.
are right, because I remember when I was speaking with the person, I was like, is it that the doctor, they didn't take your blood pressure? He said they checked and they said they know it was high, they gave her drugs to take. I was like, why didn't they? That was what prompted me to ask, okay, is it that the pregnancy is not there? She said the pregnancy is there, that probably that week she went, that was her week for delivery, the EDD. And I was like, now they know that this pregnancy is there, why allow you go home?
Wait, no.
I felt really bad. I felt really pain because this is a situation that could have been prevented.
Avoid
And
it.
this hypertension that we are talking about, this preeclampsia, has been noticed for a long time in that pregnancy. They've been managing her, and I presume that the blood pressure was low before she went for that routine checkup, and it went up, and they asked her to go home. Now that week, just 1 week, 7 days difference, that was what killed that baby. By the time she was going back, probably she noticed some changes and went back, the baby was gone. she had to still go through that process of vaginal birth to bring forth a dead baby. I guess nobody wants to experience such in life.
Nobody.
So it's always good to visit the hospital and take proper care of yourself. If you notice any symptoms, most times people around me say I complain a lot, because I try as much as I can to observe every single detailed change in my body system. I know when something is wrong in any part of my body, because I try. As a woman, we need to understand our body mechanism. You know how your body functions on a very normal day, and if there's any change, you should also know. You don't take things for granted and the causes, because I know that somebody cannot just they come down with preeclampsia and pregnancy. There may be some things, one or two things that we or pregnant women do that bring them to this state.
Okay, well, actually, hypertension does not actually have cause, whether in pregnancy or outside pregnancy. But there are some things that we call risk factors, things that could predispose one to having preeclampsia. It's like you are at risk of having it. Not like it's completely said that these things are the things that are causing it. But all things being equal, if all these things are put together, the chances that you have preeclampsia is very high. And we call those things risk factors. There are some we call the major risk factors or high risk factors. There are some we call the low risk factors. Now I'm just going to list them. First, the major risk factor is one, someone who is having history of chronic hypertension, right? A history of chronic hypertension and you are now pregnant. Chronic hypertension is that you were having hypertension before getting pregnant, right? That is one of the risk factors, one of the high risk factors. Another is CKD, chronic kidney disease. Someone who is having a medical condition of CKD is also at risk of having preeclampsia, and this is also a high risk factor. Another is pregnancy-induced hypertension. Someone who is having pregnancy-induced hypertension is at risk of having preeclampsia. Another is diabetic patient. If you become pregnant, you are at risk of having preeclampsia. There are some autoimmune diseases like lupus, systemic lupus erythematosus is a high risk for preeclampsia. Another is antiphospholipid syndrome.
Yes.
Don Jason is a high risk.
Guys, I hope people are hearing this big grammar.
Yeah,
I'm a little confused.
You don't need to be confused. The truth is, that is why you must attend antenatal. Your doctors will ask you a lot of questions on your first day. Do you understand? In order to know whether you are at risk or not. Antiphospholipid syndrome is the high risk factor. The low risk factors are a patient who has had preeclampsia in a previous pregnancy is at risk of having it in subsequent pregnancy. Do you understand that? A woman who was married to a man before, left that man and got married to another new man, and became pregnant for this new man, is at risk of developing preeclampsia. A woman who is getting pregnant for the very first time, which we call primigravida, is at risk of developing preeclampsia. There are so many more of them. I don't want to waste your time with all this. A woman who is less than 18 years and greater than 35 years is at risk of having preeclampsia, and many more. Many more. These are actually the risk factors to preeclampsia. If a woman has developed pre-eclampsia, the chances, if not taken care of, eclampsia is on its way, which we normally call. I asked a question in one of our morning review. I was asking the consultant, is it that eclampsia has become the killer of pregnant women? Because when they come at this stage, majority of the time, there is nothing you can do except someone who is, God is just with the person. At this stage of eclampsia, there is nothing you can do. The chances that the woman will go is very high. The chances that the baby will not survive is very high. But I'm not saying that they do not survive. We've managed a lot that survive. But it all depends on the state at which they are coming. Thank you.
Having explained or listed the risk factor for preeclampsia, how will someone know that she is down or is having preeclampsia? Is there any symptom? Is there anything to any sign that the woman will know, okay, I know I need to rush to see my doctor?
Yes, yes. My friend, if you've not been listening to everything I've been saying since, you must listen to this part. Because early diagnosis is the best method of treatment or prevention of the morbidity and the mortality that is associated with hypertensive disorders, which preeclampsia and eclampsia are one of them in pregnancy. Early diagnosis. First, as a pregnant woman, there are things that you must not play with when you see pregnancy. The number one here I want to mention is when you are pregnant and you are having headache, you must not play with headache. You must, even if it's at midnight, you must call your doctor. You must run to your doctor. I don't just mean a quack. I don't just mean a doctor. I mean a specialist, someone with experience, someone who has been in this art for years. You must see a specialist. Let it be that he will be the one to tell you that, madam, you can go home, you are fine. After carrying out some investigation, when you feel headache, you must not play with that. You must run to your doctor. You must run to a specialist. You must run to someone with experience. Number two is, when you are having blurring of vision, you must not sit at home. Even if your mother-in-law comes to you and say, when I was pregnant, I experienced same thing. Don't listen to mama. You must run to your doctor. Even if your husband says to you, I don't have money yet, next week we will go. My friend, you must run to your doctor. Blurring of vision, you must not joke with it in pregnancy. Another is nausea and vomiting. You must not play with nausea and vomiting. Once you start seeing it, you must rush down to your doctor. Let it be that he will be the one to tell you, go home. We've checked you, nothing is wrong with you, you are fine. Just that you are just stressed, to go and rest. Let it be that he will be the one to tell you that. When you start feeling epigastric pain in your chest, you must not sit at home. Even if it is at midnight, run to your doctor. See a specialist. See someone with experience. See a gynecologist. See an obstetrician. You must not be at home. You must not. When you start seeing that, despite the amount of water you are taking, you are not urinating frequently. I don't mean frequency. You are having oliguria. The amount of urine you are passing is so small. Do you understand? The amount of urine you are passing is so small. You must see your doctor. These things are abnormal. They are pointers to preeclampsia. When you are seeing swollen legs, swollen hands, swollen face, which we call edema, you must not play with it. I'm serious. At this point, I must be serious. Do you understand? At this point, I must be serious. You must not play with it. You must run to your doctor. Let it be that it will be your doctor that will tell you, go home. This edema is just a normal one in pregnancy. It's not the bad one. Let it be so that it will be the one to tell you that. But don't assume that your mother-in-law or your mother or your sister had swollen legs when she was pregnant. Your case may be an exception. See your doctor. You must see your doctor. When you see all these things I just mentioned, look at me. Look at me. Headache, blurring of vision, nausea and vomiting in your mouth, epigastric pain, low urinary output, edema, swollen face, swollen hands. You must rush to your doctor. Not just a doctor, not a quack. You must see a specialist. You must see someone with experience. Thank you.
Thank you so much for this. But I don't know the term or the language to use, but I know that I have learned so much, and those of us out there, this wonderful family, that you guys have also learned a lot. It may not be for you. You may be through with childbirth. You may have a friend, a neighbor.
Children.
You even have daughters that you'll be able to say, okay, when they are married and they complain of these things, you'll be able to, okay, know the kind of advice to give. And if at this point you haven't subscribed to this channel, I don't know what you are waiting for. Please subscribe to this channel, and when you subscribe, hit the notification button so that you get notified whenever I upload a new video.
And if you have a contrary view to this, you have to leave that at the comment section. And if you have the same opinion with us, please like this video so that we get to know those people that have contrary opinion and those people that have same opinion with us. If you've not subscribed, please do that right away. Don't say later.
In conclusion, what advice do you have for people out there concerning pre-eclampsia?
Well, in conclusion, I will say that I know I've already given you the definition. Look at me. Just look at me. Head, headache. Eye, blurring of vision. Mouth, nausea and vomiting. Chest, epigastric pain. Your waist region, low urinary output. Your legs, your face, swollen. You must report any of this to your doctor. Don't wait, don't delay, because pre-eclampsia and eclampsia are deadly. The morbidity and mortality rates are very high. The mother is not spared, and the fetus in the womb is not spared. You can protect your child. The decisions you make will have a long way to go to determine the outcome of the kind of baby you will give birth to. Thank you.
Thank you thank you so much for praising our channel once again. We are very, very grateful. I will say thank you so much. And if you enjoyed this video, please hit the like button, share this video. You may be saving someone out there. So when you watch this video, make sure you watch it to the end, like this video, and share it among your friends. People need to be enlightened about this condition in pregnancy. And we'll see you guys in our next video.